Two, go. All right, hello everybody. Thank you for joining us today for our spring quarter alumni panel. We have 4 alumni today with us here. We will run through a series of questions, and before that, we'll go ahead and do brief introductions. Here in the room, I have with me Dr. Chuck Griffiths. He graduated from the University of South Florida with a BS in nursing in 1976 and worked 3 years as a critical nurse before moving to LA and completing a master's degree for his CRNA degree at UCLA's Department of Anesthesiology. He worked at UCLA for 30 years, becoming chief CRNA and entering the UCLA School of Nursing for PhD training, completing his dissertation, specializing in the pathophysiology of acute pain, followed by several postdoctoral projects. In 2011, he transferred to the West LA VA, where he worked for 8 years and joined the USC Doctor of Nurse Anesthesia practice program in 2016, where he teaches research and supervises doctoral projects. He continues his relationship with the UCLA School of Nursing as an assistant clinical professor, yay, and teaches in the acute care NP and DNP programs. He recently completed a joint USC-UCLA national research project exploring suicide prevention in students, and he's widely published author, speaker, and lecturer. He advocates and lobbies legislators for nursing, nurse anesthesia, and patient care at the local, state, and national levels. So that's Dr. Griffiths. In the Zoom room, we also have Kristen Rhodes. Kristen Rhodes is a graduate of the School of Nursing of 1991 with a bachelor's degree in nursing. She worked in oncology and case management for persons with AIDS. She returned to UCLA for a master's of nursing in 1999 with a focus on family practice. Since graduating, she has worked in family practice, addiction medicine, retail health, college health, and secondary care. She is currently practicing with Providence San Joseph Medical Groups in Orange County and has taught lectures at Cal State Fullerton and UC Irvine School of Nursing. She has served as CINP Board of Directors, CINP Speaker of the House, as well as CINP Nurse Practitioner of Distinction of 2019. That's Kristen Rhodes. Moving on, we have Crystal Cadavid. Crystal is a public health nursing supervisor with Los Angeles County Department of Public Health. In her nearly 10-year service, Crystal has worked on a variety of community and systems levels initiatives, ranging from emerging infectious diseases, nursing roles, and antimicrobial stewardship. Cross-sector collaborations addressing social determinants of health and inequities, implementation of health and wellness-related legislation, COVID-19 response, and more. She currently oversees public health nursing engagement partnerships in the San Gabriel Valley. And prior to her time to DHP, Crystal worked as a medical surgical nurse. She is a BSN graduate of UCLA and obtained her Master of Science in Nursing in Public Health from the University of Hawaii. Cool. We also got Lori in the Zoom room. Lori Mitchell is the founder and president of Criterion Edge, a global medical and regulatory writing services firm serving pharma, biotech, medical device, and in vitro device industries. Lori has over 20 years of experience in medical writing, safety, and pharmacovigilance management, and regulatory reporting, having provided regulatory solutions to many pharma and medical device companies, both large and small. She's a proven leader in designing practical strategies to meet current global regulatory challenges. Lori is a published author and holds a Master's of Nursing from UCLA. And lastly, but certainly not least, we also have here in the room, Debbie Norman. Debbie is a UCLA School of Nursing class of 2021. She got her bachelor's degree in psychology from Cal State Northridge in 2017 and joined the MECHAN program at UCLA in 2019. Throughout her time in nursing school, she was unsure where she wanted to go in the vast field of nursing. She did not see herself doing bedside nursing, which made her second guess her degree choices. But after graduating, she took a leap of faith and applied to the UCLA new graduate perioperative program and has been in the operating room ever since. She currently works at the UCLA Santa Monica Surgery Center, and she's very happy and grateful to have found her niche in the field of nursing. Awesome, very cool. So we have a room full of superstars here. We're just gonna go ahead and go around the room. Tell us a little bit about yourself. How about tell us where you grew up and about your current position? We can start in the Zoom. How about we hear from Crystal?
Sure. Okay. So I'm grew up mostly in LA, kind of moved all over. I guess outside of what was already stated, I work in public health and I get to work with a community. So I'm actually based out of Pomona, which is why I'm on Zoom, because I'm about as far as you can get from LA County. And it's a pretty neat role. I mean, we basically get to bring health into spaces where health is not the primary focus, I guess. And so there's a lot of really interesting cross-sector collaborations, a lot of really outside the box thinking and different things that we have to suddenly become like experts in and try to be able to speak fluently in those community settings so that we can integrate it with our health concerns. So, yeah.
Thank you, Crystal. How about Lori?
Thank you. I went to UCLA in the early 90s. I graduated in 1993, wrote a thesis. My clinical background has always been critical care nursing. I graduated from UCLA as a cardiopulmonary clinical nurse specialist. And so my clinical field and my practice, bedside practice, has always been in critical care. I started the company. This is actually the second company I've started over the years. And I think what I want to say about what I learned at UCLA, I was a fairly young mother. I came from Bakersfield. I drove twice a week, drove back, came 2 days later, drove there, drove back. And the kids were little at the time, 6 and 3. And I just want to share one thing, is that I went to UCLA and I was surrounded by leaders, national leaders, people that I knew their names. And guess what I found out? I found out that they were mothers, they had little kids, they had lives. And it's like, oh, and look what they've accomplished. And so I think that was what unlocked for me the magic at UCLA, is that you can do anything. And that's my story with UCLA. 3 years back and forth until it was done, and started one company and then left that and then started Criterion Edge about 7 years ago.
Nice, that's wonderful.
And practiced and I practiced at the bedside until 6 years ago.
Wow, that's amazing. Thank you, Lori. How about Kristen?
You're welcome.
So I'm a New England transplant as a child. I came out from Massachusetts to Newbury Park, which is in Ventura County, north of LA County. And all I wanted to ever do was get to UCLA. And I was really happy to find the passion of nursing. And, 91 was my undergraduate year, and we had such a blast. And I was student government then, and then came back. I basically got injured on the floor doing oncology nursing. That's what got me into quality management and quality care. But I knew I was going to get a master's because I met a nurse practitioner at student health at UCLA. And then after that, I just, I had moved down to Orange County right after undergraduate school. So I've been basically here since. My current role last year was the first time I'd ever been laid off from a job. I was absolutely shocked. It was the best job ever because it was all advanced practice clinicians, PAs and NPs, serving same-day care. And so it basically, I got rehired within the organization under the medical groups. And what's been really cool about it, which has always been the concept that I've thought, like, if you can't afford to hire a nurse practitioner, all the nurse practitioners should be in one place, and then you can use us. And that's kind of what it was when I worked for Express Care under Providence. And now that's what I get to do, is same day care. And patients love it. They love not having to go to the urgent care if they don't have to, and they love the care that we give. I've since graduate, I've been primarily primary care. So it's funny that I have a real passion and compassion for death and dying, but coming out to primary care allows me to help with preventive health, and I love that. Thanks.
Awesome. Thank you, Kristen. In the room, Debbie.
Hi, everyone. My name is Debbie Normand. Outside of what was stated already in the bio, I really wanted to emphasize first how lucky everyone is to be at this school. Now being a perioperative nurse in the OR, I'm one of the only people who's graduated from here, and I could truly see the difference on how we've all been groomed coming here. There's something really special about like keep your stamina and wanting to learn more. And I think coming here and being part of the MECN program really motivated me to always wonder and question and how I could advance myself in my career. And now being in this room full of so many people who've gotten so many degrees and so many acronyms by their names, it really inspires me. So I've been in the operating room now for 2 years. This is where I've started my career. And like I said in my bio, I was really kind of second guessing, is nursing really for me? But then I kept having to remind myself in the program that it's so vast and there are so many different avenues of nursing, which is why I came into this profession in the first place. And that's pretty much it. So
Awesome. Thank you, Debbie. Dr. Griffiths.
Yeah. So, is it still morning? No. Good afternoon, everybody. I'm Chuck Griffiths here. You know, having to ask that question, my students would all laugh because they all call me the absent-minded professor. Very absent-minded, except when it comes to reading their capstone projects and saying, no, not that paragraph. This one. I am, of course, clinically a CRNA. I don't practice in the operating room anymore, but I still teach at USC. They have a doctoral program of nurse anesthesia there. And my journey here at the school actually started in 2001. The fall of 2001, we had just had the country attacked, you know, in New York. The ruins were still burning of the Twin Towers. And I started school here and found a wonderful home. I wanted to have a PhD. And the instructors that taught me, I was already, of course, the chief CRNA across the street at that point. But I wanted to get this PhD because I had questions about pain that couldn't be answered any other way. Couldn't be answered any other way. And so I came back to school, found this wonderful home, and I found this amazing education in how to think about thinking, how to write, how to express myself clearly, how to look at problems and figure out what's really going on here, and then figure out a way to make it better. And I'm so eternally grateful for all the faculty, you know, at the school that helped me get there. And one of the things that they also did for me, well, they did two wonderful things. One thing was to tell me never let your relationship with the school lapse, because if you stick around here in LA, you're going to want to come back and do some teaching and, you know, maintain a relationship with people in the school because there's so many resources. So I've always taught here as an assistant clinical professor, and thank goodness, met so many wonderful students. Debbie probably was lectured to by me back in the day, you know, and that's been a wonderful thing. They also taught me about advocating, though, because I know that Dean Cowan was a huge advocate for nursing when she was here. And so I, at her behest, became the president of the California Association of Nurse Anesthetists and immediately learned how to go to legislators' offices and explain, number one, how to say nurse anesthetist, and number two, what we did and how important we were. And I've never stopped since then. I still am on a first name basis with my assembly person and my state senator, and you know, and also write my federal senators and of course my federal congressperson. So I'm a great advocate. So along with all the teaching and stuff that I do, I also advocate. And I would just say, for all the students that are going to be hearing this, those that are tuned in now and that are going to hear our recording, is never stop advocating for yourself, because we're our own best advocates. Nobody can really speak for us like we speak for ourselves, because nobody else really understands the importance of nursing and the amazing things that we in nursing do for the country and for the world. So that's kind of my little piece of my story at this point.
All right, thank you. And we do have in the room who just joined us, Ursilia Pompilio. How's it going? Would you like to introduce yourself? Give us a little spiel of what you do and where you are.
Cool. So I'm Priscilla. I do a lot of stuff. I've been in many places in nursing. So I graduated in 2005 from the pediatric nurse practitioner program here, which was amazing. I always wanted to be a nurse practitioner. That was my main goal in pediatrics. So my my journey has been very, very interesting. I started in private practice. After that, I went into teaching. I've taught at like 4 universities. I worked at Children's Hospital at a place called Surgical and Admitting, where I've seen every kind of pediatric surgery and problem under the sun. So I did that for 6 years. I got a little bored. I'm a creative at heart. I come from 2 entrepreneurial parents. So one of the things that I always wanted to do was write. So I found a boutique writing school. I took classes from 2008 to about 2012. And I always thought it was like, this would be so great for nursing, you know. I did a 1-person show called The Nurse and the Hypochondriacs, which was about men I was dating who always wanted to talk about their problems, and it was a way of relating to me, you know, because I was a nurse. So it then morphed into a storytelling show, which I premiered in 2015 at the Hollywood Fringe Festival. And I had other nurses, storytellers, comedians that had health-related stories. And I did about 17 shows all over the place. Then I started my own, the Well-Written Nurse writing courses and storytelling, which have been a lot of fun. And I teach those through Zoom. And it's an intro to writing and storytelling. I also do journalistic writing. What else? Journalistic writing. I have my podcast, The Nurses and Hypochondriacs podcast, which we have about 131 episodes now. I've interviewed 131 people, which is awesome. And that's all kinds of people. Authors, storytellers, advocates, patients. I just had on Dr. Anna Lemke, who wrote the book Dopamine Nation. She's the director of addiction medicine at Stanford. When she said yes, I was like, you know. So I've had so many awesome people on. And now I work as a pediatric nurse practitioner. So because I love private practice. I mean, I love seeing my patients. I kind of call it my lab, where I can also use my storytelling techniques. So I work in rural health in Joshua Tree, California, and Palm Springs, California, which is where I live right now. So I cover 2 clinics whenever they need me. And yeah, so I've also worked as a nurse marketer for a pharmaceutical company for a couple of years, where I learned a lot of tricks and techniques where I have put into my writing and advertising with my clients. What else? I've also worked at Disney World. I've worked in studios as well as a nurse. And one of the things I love about nursing is it's so multidimensional. You could do so many things. You think nurse, you can create it. So yeah. And I'm in the middle of launching a nursing magazine, because if you've heard of the Woodhull study, which says not too many nurses are going in front of the media, one of the reasons is because they're terrified, they don't know how, and they're afraid of losing their jobs. So I've only gotten more and more jobs with telling people I have a podcast, because I used to work for locums and nursing registries, and they're like, sure, that's awesome, can I be on your podcast? So I've never gotten told no on a job because I have a podcast or because I'm in the media. So yeah, so I always am a huge advocate of nurses writing magazines. Like I published several articles in Working Nurse Magazine in the lead, and now I write blogs for a couple private companies that are locum tenens. So I'm able to put all my experiences into my writing, and I love to teach other nurses to do the same thing too.
Great. Thank you. Thank you for that. For our next question, how did the UCLA School of Nursing prepare you for your current career? And like I said, we do have a room full of superstars here, so feel free to shine. How about Kristen?
Well, for our lovely undergrads, you will feel absolutely unprepared to start your clinical role, and even our graduate students. And the reason being is that the stuff that you're going to learn to do clinically to become competent that becomes natural as you do it with repetition. But in order to be the leader and to step into different roles of critical thinking, development of plans, development of processes in the office, stepping into some form of leadership all the way up into management, that's why you were chosen to be a UCLA student in the first place. And I didn't realize how much that made an impact until I got older. And you know, I was active as a student on the board in each class. I was active on the alumni board. I'm still also involved in alumni, and those things, those opportunities that UCLA gave me, gives me all of that places to learn and to grow. And, you know, when I go in, one of my roles under Express Care was I was a clinical lead and could help teach and train and to develop new ways of thinking, to find out, you know, digging through Epic and finding out the tools of why some things weren't happening and why this could happen. And like, nobody told me that at UCLA. It was the base of the critical thinking and the training that we got. And it always feels threatening, like that's not enough when you start to go out and get a job. But it really is taking that deep breath, giving yourself grace, because that leader potential of you, even though you don't want to step up and be a superstar, it's still going to make you the best patient advocate for whoever it is that you have in front of you.
Thank you, Kristen. Lori.
I'll jump in. Yeah, I started at UCLA in the master's program, as I said earlier, as a clinical nurse specialist after already being at the bedside for 10 years in critical care. And I think the journey that I took away from, and I mentioned it earlier, is such great role models at UCLA in the early 90s in the master's program. And as a cardiopulmonary clinical nurse specialist, I did research. So I did a thesis, I did qualitative research and a thesis. So all of those little pieces, you never know how they're going to fit together. I started my first company right after that. Through that, you know, that went on for a long time. We did clinical trial research. We ran clinical trial sites up and down California, all the way up to Seattle. And so you meet somebody, and then you meet somebody else, and then that job ends. You know, you move on from that role, you sell the company, whatever it is you do, and then you have more people that you talk to. And then somebody called me and said, "Hey, would you like to?" I was always at the bedside during those times, so it was seamless for me. I just increased my hours in the ICUs that I was working in. But then somebody calls me and says, "Hey, can you do some consulting for me with a large medical device company in the Bay Area?" Sure. And so I started there. And how did I get that job? Because I had a master's degree, because I was cardiopulmonary. And this particular medical device company does a lot of, it was stents and things like that. So the devices like that. And I'd done, again, as I said, I'd done research. And so, you know, all these check boxes fall into place. I start, and that's what I've been doing ever since. I no longer work at that company, but I started a business after I left that company. And now I work with medical device, in vitro device companies and pharmaceutical companies worldwide. My point is that you never know, you know, one step here, one step there, one step somewhere else. I've also taught nursing at Cal State Bakersfield for a number of years in between all of this. So my takeaway is, and my message to anyone who's listening is, it's one step at a time, and then somehow then the path just opens up. That's my story.
Thank you, Lori. Crystal.
I completely agree. And now I'm so glad you said that, because it makes so much sense when I think back and looking at it. It's really true. I mean, when you first go into whatever specialty you're going to go into, your first nursing job, nobody knows what they're doing, trying our best. And that's just kind of come into play. And that's totally fine. But later, once you're past competency, a lot of the virtues of like excellence, and a lot of ways that you push the envelope, and a lot of the ways that, you know, we were expected more of from being from UCLA, that really does come into play. I mean, you know, even in my current job, I'm obviously, you know, I'm systemically biased because, you know, I do work in the community health. So I'm always looking at policies and programs and evaluations, but I don't think I would be able to do it at the level I was if I wasn't already thinking about that, like back in my undergrad days in the early, you know, in 2011 or the late 2000s. And so, yeah, and it served me well. I mean, I have published, and you know, for a government agency that moves very slowly, like it's kind of neat to be able to do those things. I've questioned things, I've changed policies, like I mean I've been able to do a lot of that, and I yeah, I agree. It comes into play a little bit later, and then you just kind of soar.
It really is just one step at a time. It really is, and you never know where it's going to lead you. So yeah.
Great. Thank you. Dr. Griffiths.
What was the original question again?
How did the UCLA School of Nursing prepare you for your current career?
Well, I think probably the most important part for me, from my experience here in the PhD program, was again, learning about metacognition, how you think about thinking. You know, how when you're presented with a problem, you know, something's going on that you need some kind of solution for, especially as a nurse, you know, working. You learn how to, in the PhD training that I received, you really learned how to use all of the master's level training that you had as a background. And this kind of goes back to what Laurie was talking about, the stepstones. You know, I mean, I had a lot of stepstones in my career because of my master's training. I learned to really focus on all the clinical stuff as a nurse anesthetist. Again, gained all of those skills. And then in the PhD program, it kind of built on that because it taught me to take those skills and look further into why is this a problem? Where does it come from? What are all the forces coming to bear on it, both internally and externally? What are the opportunities for growth here? What are kind of the opportunities for risk in you know, dealing with a solution? And then coming up with a number of different solutions and figuring out which one's going to work by evaluating the actions that you take. And I think the school really helped me with that because in the PhD program, you really do get a lot of learning about metacognition, again, because you're always focusing when you're actually in the PhD training, you're focused on your particular clinical problem. The problem I focused on for my PhD training was very different from some of the problems I've faced in my career as a nurse. It was, you know, what's the link between pain and the immune system in the body? And how do the two things interact? And I would just say that even though that was a very different problem from when I went back to my chief role with my PhD degree, and I was faced with a problem of, you know, how to cover different the needs of the university operating room schedule with different shifts of anesthesia providers. The process was the same. Looking again, step by step at, okay, so what's the problem? What are all the forces? What are the possible directions we can go in? What are the risks here? And then coming up with solutions, whether it's pain in the immune system or staffing the operating room, you know, which, you know, our friend Debbie here knows all about. You know, we can't do it without you and me both, right? We need those darn surgeons too, but we need us. And so, again, I think the main message for me, UCLA taught me how to think about thinking and how to really be a tremendous problem solver with so many problems for the world and for nursing.
Thank you. Debbie, let me repeat the question. How did the UCLA School of Nursing prepare you for your current career? I know.
I would say outside of the actual clinical work, because unfortunately we didn't get that clinical opportunity to go into the ORs during the program. I'd say, as I mentioned earlier, just that willingness to kind of take those risks. I was just really inspired by the people at the school and working as a team as well, which is really important in the operating room. But our program is really research-based, and especially that big research paper that we wrote at the end. I'm now really comfortable and about to become our co-chair for our UPC. And so we have to do a big research as well on the unit. So I'd say that's how it really helped me.
Thank you. Ursilia.
Well, I came into UCLA with about 10 years of like mostly registry nursing. So I was used to working on my own. And so when I came to UCLA to do my clinicals, it was like, make it happen, make it work. Because I was like, well, this is like far And this doctor is kind of make it happen, make it work. And I was just like, okay, and I did. And so I think that's one of the most valuable things that I is really dealing with someone who may be difficult and trying to figure out a way. I was like, oh, okay, how can I make this work for me? You know, and I've taken that in my career now as well. And I just recently had a situation where I had to go to my medical director where something wasn't going right with one of my medical assistants. She had been there for a very long time. The doctors really like her. She does a medical building. And I was like, well, she doesn't work for me because there was a lot of very bizarre behavior. And I could have left. I really love my practice and I love my patients. And I've been there since 2017. And going out to work in Joshua Tree is absolutely amazing. So I took it upon myself to really, you know, tell him I can't work with her anymore. And this is how I need to work. And he accommodated. It's amazing. You know, so many people get afraid to, you know, ask for certain accommodations. So I think that is my takeaway, and it's still helping me from like 2005, almost 20 years in the practice, where I was like, how can I make this work for me? Yeah. So, and what Lori, just to touch upon what Lori said, I did that. I was given so many different opportunities, and I took them as they came, and they were
Yeah.
so fun. What was happening is be careful of the naysayers in your life, you know, and if you know anything about writing, there's all these antagonists around the protagonists, and they will try to stop you and get in your head of your own journey. You're on your own personal journey, and only you know what's right, you know. All my coworkers, I remember at Children's, just thought I was an alien. What are you doing? Why are you doing that? You know, why are you, you know, and it's just like, so all their stuff was being projected onto me. But looking back, I was like, oh my gosh, I'm so glad I took those opportunities, because look at me now. I'm doing like fun stuff. I'm in a very fun place, and that's what I'm all about, you know, having fun and enjoying my work life balance. So
Oh, I like that answer, because that's a nice segue into our next question. And I do see that Chelsea just joined. You hear us, Chelsea?
Yes, can you hear me okay?
Yes. Would you like
Yeah.
to introduce yourself and go ahead? So, yay, Chelsea is also another one of our alumni. She just hopped in, so feel free, go ahead.
Okay, I'm not sure why my video isn't working because it was earlier. So I'm sorry, I didn't hear what was just happening.
Yeah,
did you
just
want
tell
me
us
to
about
do-
yours. Yeah, just tell us
Okay,
about
yeah,
yourself.
sorry.
Yeah.
Yeah. So I am currently working as a dermatology nurse practitioner. I'm based in Washington, D.C., but my background includes emergency department nursing, and I'm also a flight nurse with the Air Force under the Air National Guard in California. So I do have to go back to California every month to do my flight nursing duties, but yeah, so it's really fun, able to kind of work across the whole spectrum of nursing as both a flight nurse and then also working in dermatology as a nurse practitioner. It's very fun.
Tell us what's a flight nurse.
So what I do with the Air National Guard as a flight nurse is, so it's actually it's not the same as civilian flight nursing. So even though we can manage critical patients, we can fly independently and also with a critical care air transport team. So that would have like an actual doctor on board with us when you're having patients who are intubated or who have other like really severe injuries that are going to require a little bit more extensive monitoring and treatment. But in general, with the flight nursing with the Air National Guard, it's basically a crew of 2 nurses and 3 technicians, and we're flying anywhere between like a couple of patients to like 50 plus patients across, honestly, the globe. If we're overseas, we usually bring them back to the United States for further or increased levels of care, or moving them from a forward operating base to a higher level of care within Europe. So it's pretty fun. It's actually very fun.
Awesome. Thank you. For our next question, how would you describe your work-life balance?
Yeah. My work-life balance is something I've had to learned to manage over the years. I think what really helps is I actually have a 4-day work week. And it's about 8 to 10 hours for those work days. But I feel that I try to really protect those hours and not really work beyond those hours if I don't have to, related to my full-time civilian job as a nurse practitioner. And I ensure that I have an adequate amount of time that I allot myself throughout the week to really focus on me and things that are helpful for me to de-stress. So I do jujitsu, I do Muay Thai. I like to take my dog on really long walks. I try to visit, this is going to sound really random, but bodies of water. So I'm like a beach girl at heart. So I try to make sure that I visit lakes or rivers or go hiking where I can see water and I just feel, at peace, and kind of helps manage my stress that way. But I'm very much someone who, I work hard, but I also am very protective of my time to de-stress. So I try not, it is a balancing act, like you mentioned, like it's something that you have to work on and learn how to manage over time. So I think a lot of new people are not maybe great at it initially.
Thank you, Chelsea. How about Lori?
Oh, I might be the wrong person to ask about work-life balance. I'm the president of a company. That's not a thing. Work-life balance, it's just about work. I mean, it's different when you're working, when you have a global company and pass. There's no work-life balance right now for me. I'll let
Thank you for
somebody
the
else
honesty.
say, it's not a thing.
How about
I was
Kristen?
hoping you weren't going to call on me, and I was just going to stay silent.
That's so funny. Okay. How about Kristen?
Super important to me. I've actually lectured on it. I teach my patients about it because it's really critical. I think, it's a blessing when you're doing floor nursing because you have these 312s. And I remember back then I would tell, because I lived 5 minutes from the hospital, I go, if you call me before 6 o'clock in the morning, I will not volunteer an extra shift. But if you wait, then I'm going to be more flexible because my sleep was more important because I don't sleep very well. You'll find, especially like the NPs, it's kind of frustrating that in big organizations, it's really hard to find part-time work. So, I'm in a position, they just switched everybody over last year to do the 410s. I really loved the 312s. But on those days off, I cluelessly forget that I have Tiger Text or that I'm on Epic Chat or whatever, because I know what I'm doing is not life threatening, that it can wait till tomorrow. It's important to me to meditate every day. I never thought I would want to work so close to my job, but I am literally a 2-minute drive. So I can come home I only get a 30-minute lunch. I come home, I eat lunch with my dog, give her an apple, I get regrounded, and I go back and finish the rest of the afternoon.
Wow.
And it's just, I didn't realize how much I needed that until I don't get it. And if a patient's running late and I'm missing my lunch, it just frustrates the hell out of me. But I love to cook, and it's important, when I'm trying to cook healthy, I'm not 100%, but those things are important. And I need to balance because these are my quilts. These are my mom's, but I'm a creative, multi-passionate maker is the word. I'm very active in my NP organization. I do other volunteering activity, and it's like, it is a little bit of a juggle, but I enjoy planning. And so when I put it in my little planner, that helps. And I'm also really good about, downtime. If I'm not doing well, and it's just trying to put myself to bed on time is the biggest thing I'm working on lately. Thanks.
Thank you, Kristen. How about Crystal?
Oh gosh, this is going to sound unrealistic or like an advertisement, but work-life balance is pretty excellent in my field. This is a desk job. I'm out in the field here and there, but I have a Monday through Friday. We also have alternative schedules if we want to do 440s or like take alternating days off. I don't have weekends. I have I don't work weekends. I don't work any of the major holidays. I'm home at 4:30. I also work pretty close to work, so it's really nice. We get a 1-hour lunch and like a 30-minute wellness break. Like it's really good. I haven't always been this way. There was a little period where I was itching to do bedside again, and so like right before COVID, there was a year where I had like a per diem job doing med surg. I don't know why. I think I just missed like touching people. I just miss like connecting with people, and so. But I noticed my health declining, and so after that, and certainly during COVID, when we were working like insane hours and doing all sorts of things. I really came to appreciate more about how work is fitting into my life as opposed to life fitting into my work. And that was a big switch for me. And I think at the end of the day too, because even here at our center and in terms of what we're outreaching and what we're educating the community on, it is about wellness and like health outcomes. And so we have to practice what we preach as well. And so we really strive to do that. I really strive to make that environment for my nurses that I manage as well, so that we can be authentic in what we're sharing.
Awesome. Thank you. In the room, Dr. Griffiths.
Well, my second area of research has been wellness. We just, me and my research team at USC and UCLA just completed a whole study on suicide prevention for student-registered nurse anesthetists. And it just really, the findings that we found from this survey research among the students, and also we surveyed the faculty, really serve to indicate how very important work-life balance is. I think everybody in this room knows it, but you have to have work-life balance. You cannot devote so much of yourself to work that you squeeze out the part of yourself that takes care of yourself and your life, because all of us have lives outside of our profession. And it's just extremely essential for wellness, to prevent burnout when we're talking about work situations. Debbie and I really wish the operating room worked like Crystal's work setting works, but the operating room doesn't work that way. The main operating room, it works 24/7. And so if you're a person who works in that environment, it's up to you to take the responsibility for whenever you're not there, do something else. Get your mind off of it. Do something that creates some fun and some joy in your life, because if you do too much work, and this is a big problem with the nurse anesthesia community, because the nurse anesthetists working privately and for institutions can work all the overtime they want to work. I mean, they can work all the time, and a lot of us do. And what they find is the more they work, the less happy they are. Yeah, they make more money, sure, but the less happy they are, because that burnout syndrome, it's where you start detaching from the objectives of your work because you're sick of it. You never want to see another patient again after a while. You just want some downtime and some fun time. You start getting depression and anxiety. So it's so important to limit the amount that you work to what you really need to work, and then spend the rest of your time doing what brings you joy and happiness in your life, so you can get away from the burdens that we all face as nurses during our work, and find again that work-life balance. Very important for wellness.
Thank you, Dr. Griffiths. Debbie.
Yeah, so I started as the new grad at Santa Monica Surgery Center in the OR, and it was a 5 days a week, 8 hours a day, weekends off, holidays off. So kind of like Crystal, it was really nice, and I was very excited to have that schedule until I kind of started to feel burnout. And it sounds kind of silly because I was really doing that for a year and a half, and I already felt like I just need to call in sick just to have a day off in the week.
Yeah.
And I recently changed over to 410s, but it is still nice because we have weekends off and holidays off. But what I would say for maybe the undergrad or the mechan students in here is to not think that you could do everything. You're a new nurse, and I think I found myself doing that. But in our program, they talked a lot about nurse burnout, and so it's something that I was really cognizant of. And even though there were times where I'm like, I could stay over, I could come in early, I could do this, I would kind of have to stop myself. And I would definitely recommend to be aware of that and don't bend too far back.
Can I just
Okay.
add real quick to that? Just
Sure.
because you don't have a family or a partner, it's okay to still take time off. Like, it's important to realize that, because
Yeah.
oh, well, so-and-so, you have a life, even if it's just you or your pet or just you and your plant.
Thank you. Where's Celia?
So I think it's, when I first got into nursing, nursing is very addictive. Okay, it's such a huge dopamine hit. You just, the work that you do is very fulfilling, and the money that you get is very fulfilling. I found at one point early on in my career, I was working probably 70 plus hours. I just, and I was like going through a divorce at the same time at a very young age. And can be an escapist place as well, where you could get very hyper addictive into that. Now I'm totally on the other end of the spectrum, where, you know, there were life situations that happened to me where I was like, what am I doing with my life? You know, I really want to work to live and not live to work. And I started to live my life very, very differently. You know, I have cousins in Europe where they get 5 weeks off a year. Here you barely get 2. It's really sad. And in healthcare, there's no mental health. There's no psychologist you can go talk to if your patient just expired, or if there's something going on, or if you're being bullied or whatever. So it's so important to just kind of tailor your own life to what it is you want to do and create. You know, if you want to experience work, that's good for you. You know, for me, I would always work for a registry or locums where I would take like a 3-month contract, then I would take about a month or 2 off, you know, during the year. And which was so nice. I got to travel, I got to do whatever I wanted. And now I just work whenever I need it. I have my practice in Joshua Tree and Palm Springs, where I work like in clinic about 1 or 2 days a week. And then I get called by some other physicians that are going on vacation, and I'll go cover for them. But my main thing is where I'm at in my life. It's like, what can I do to where, you know, it's about me and what I love doing. You know, I love doing clinic and I love my pediatric patients, but I want to love it. You know, I don't want to be there 5 days a week seeing 25 patients a day where I just don't know. I feel numb inside. You know, it's like I want to love what I do, and that's the way I do it. And then to supplement, I have my writing clients. I have advertisers that come on to my podcast. And now I'm like launching a magazine. So, but that to me is, I love doing that because I can work at a cafe. I can at the beach. I can, you know, it doesn't even feel like work, you know, and still having interactions. I'll go to like a play or a conference and I'll be like, hey, come on my podcast. You know, that's technically work, you know, but it's a lot of fun, and I meet so many very interesting people, and so many other doors can open up for you that way. So you need to just cater your life to your liking. And like I said, if you want to experience trying to get burned out as a nurse, that's your experience. If you know, you're on the other end, like, I just want to work 2 or 3 days a week and that's it. So
Great, awesome.
I want
That's
to add
amazing.
a little bit to
Yeah, go for it.
about the boundaries. I think that's part of what makes it easier, is because I have a separate device, like a separate phone, a separate tablet for work, and I physically like leave it here so that it doesn't go into my life. But in terms of like how I identified, I had always seen being a nurse as like my primary identity. And, you know, so, and things will happen that will shake you to your core and will make it, you know, and it threatens that, or it threatens, like, you know, I guess the way that you think about yourself, and it shouldn't be that way. I mean, you have a whole life. And so, you know, if I didn't have the additional things I did to kind of, I guess, protect me from that, you know, I like to do, like, I like to do competitive powerlifting. I race cars on the weekend, like I do cool stuff like that. And I feel like that protects me for when things don't go as well in work, because I'm no longer putting like all of my eggs in that basket. I do great work and I love what I do, but there is always going to be things outside your control that are bigger than you. And so these are kind of the ways of, I guess, taking care of yourself to make sure you can get through that.
Yeah, Juan, I have a comment about that. Again, now that I'm working in the wellness area, I don't know whether everybody on the call is familiar with the second victim syndrome, where you lose a patient, you know, something goes wrong. You know, in anesthesia work and operating room work, a lot of times it results, you know, in a very bad patient outcome, and providers blame themselves. So it's not just the patient that's been lost, but you yourself as a provider blame yourself because you didn't do something, or you did something and things turned out badly. So I think part of work-life balance is, if you do bring that home with you, and I have before, especially when we lost a pediatric patient. I know you take care of kids. Thank goodness there's somebody in this room that likes taking care of kids. I never did. Unfortunately, because I didn't like taking care of kids, the universe provided me with lots of pediatric anesthesia. And once upon a time, you know, of times, unfortunately, we lost pediatric patients in the operating room, and there's nothing quite like that. I mean, it's even more impactful than an adult death. And I brought it home with me. And I want to emphasize to everybody how important it is to seek help when you get in that kind of situation. It's okay to have a counselor. It's okay to go to a therapist. If you feel like you need help beyond just your family being able to support you and listen to you, and your friends and professional friends, all of whom can share the burden with you, go and seek help, because there's nothing wrong with that. We have such a stigma in this country around mental health, where people sometimes think when they seek therapy because they're in a bad place, they're weak. That's not true. It's the fact that you're smart. You know that you need help and you reach out for it. So I think part of work-life balance is understanding if something does come home with you, some bad outcome that you can't get away from, don't hesitate to seek help from your family, your friends, and professional help when you need it.
Thank you.
Sure.
Great advice.
That's wonderful, Chuck. That's great. I love what you just said there. Thanks for that reminder for all of us.
Thank you.
Yeah.
And we are sadly nearing the end of the hour, but we do have one final question, and I'll give you a couple seconds to kind of think about it. What does it mean to you to be a Bruin nurse? Think about your years back out here in this classrooms, in this building, and what does that mean to you?
I wish I hadn't been a Bruin nurse for quite so many years now. Sorry.
Yeah, go.
Get that in there.
Yeah.
I'll say,
Oh,
go ahead. So there's a few things about me, and one of the characters is I will always bleed blue and gold. And I'm really grateful and when I met my husband, I didn't know if I was going to go to University of Washington because I like purple, and that's my mom's alumni, or come to LA, and we got engaged, and so I stayed in LA, and so I'm so grateful I went back. Being a Bruin nurse, when I come across other Bruins and Bruin nurses, there's nothing more annoying than us in a team's meeting going, "Go Bruins!" You know, we're so there, and I see it with the physicians I work with. There's a lot of pride in being who I am, and when I meet other nurses, even we just had our big conference here in the state, and meeting up with all. I mean, there's a launch challenge here with the UCI Zots. I'm very close friends with a lot of them, but there's just something special about it. And then when I go to the college night representing the alumni that help out on these college nights for the high schools, the hungry faces that want to go into nursing, I can't wait to share with them about what they need to do, how to get in, and to share that spirit, because I love that I can be a Bruin nurse without having to work within a UCLA facility, which I didn't realize. And there is we're just a little crazy and a lot of fun when we do come across each other. And then there's so much respect when you hear people with where they've gotten their degrees, and if you're listening to their lecture or you're reading about them. But like I said, there's nothing like the spirit of being who you are and connecting with those Bruins when you're out there.
Thank you, Kristen.
I want
How about Lori?
to applaud the respect comment that you just made. Is that I've noticed that as well in my it carries some weight that you graduated from a master's or undergraduate, whatever it is, from UCLA. So UCLA's name, because I interact with people all over the country, it carries weight. And although I'm not in my business is not where it's important that I'm a nurse, but folks comment on, oh, you went to UCLA and you have your master's degree from UCLA. Yes. So there is some import to that and respect for the UCLA name.
Thank you. Crystal.
Yeah, I get a lot of, UCLA, it's been like 13 years already. And I got my master's somewhere else, but I love it. And there's actually somebody in a very high position in my massive department. And, she's also a fellow Bruin nurse, and we're unapologetically just as obnoxious. And I get associated with her, which I love, even though we didn't cross over at all. But it's always going to be a point of pride. I mean, when I joined, it was when the BSN program had just reopened, and I think they reopened in 2006. So I was in the first batch of transfers, the very first batch of transfers, and only 6 of us. And I will never stop being proud of that. And it makes me feel really, really good when I think back about that. And so it's definitely really special. The best you could have.
And
Oh,
one
thank
other
you.
quick thing too was that I came back when they were closing the undergrad program with a couple of my fellow classmates, and we will fight to always keep a nursing program at UCLA.
Wow,
Mm.
thank you. Chelsea,
Yeah, I mean, I'll just piggyback off of what everyone else has been saying about kind of like the respect aspect of it. And also for me, well, for the respect aspect of it, even being in DC, I've had patients who are like, I Googled you before our appointment, and they're like, and I saw you went to UCLA, and oh my gosh, like even all the way over here on the East Coast, people know the prominence of UCLA. And I don't think it's just a name. I think it's also the people that they turn out. When I was working in Northridge Emergency Department, back in like 2014, 2015, I worked with two other ER nurses that were also graduates of UCLA, and we had the best. It was so cute. We wore our School of Nursing jackets certain days. It was really fun, and I'm still in contact with them. One of them also went through the FNP program at UCLA, and we still keep in contact. So there's that professionalism and that support that I think that Bruin nurses have for one another. So yeah, I mean, I'm so proud to be like a UCLA, prepared nurse, and I look fondly back at my time there, big time. Very
thank you,
grateful.
Chelsea. Dr. Griffiths.
I think I agree with everything everybody said. I think that also another thing that's, that I've come to realize, which I didn't really ever think about at the top of my brain, but I think about more now in my younger years, is that the values of the school are always pretty evident to all of us that have been here. It's like the values of the school are just this unbridled humanism, where you're always there for the patient. You're always there to provide for people that are vulnerable. You're always there to try and better society and better the outcome for other people. That's the values that the school tries to instill in all of us whenever we're students here, whether at the doctoral level or the pre-licensure level. It's always that same humanistic attitude where we're here to do what we can to better humanity. And I think that more and more, in my life, as I reflect back on all of my many and varied experiences, that's something that I treasure. And I think that's a big part of being a Bruin nurse. It's where I look back on the classes that I had where my professors embodied those values, where they talked about, for example, in one of my doctoral level classes, we all talked about our clinical careers and how we were going to link those to our new doctoral training. And one of the things that we were asked to do is to figure out how it is that you're going to further bettering humanity by the training that you're getting here. And my particular way of doing that was I planned on continuing my research in pain, the area of pain relief, to try and extend to better pain treatments for people that were unable to afford, the sort of the top drawer treatments that were available, but having some pain treatment for everybody. And that was actually one of the things that, me and my team have worked to do over the years. So I think, yeah, having those values instilled in me, that's what it means to be a Bruin nurse for me.
Oh, thank you.
Yeah.
Debbie.
There are two words that really stuck out to me out of what everyone said. It's professionalism and respect. For the respect aspect, it's respect from others, but also respect for yourself, knowing that you graduated from UCLA. Now UCLA being the second best in the nation, I think the second I got accepted here at UCLA, it was a different level of respect that I feel like I felt like I finally made it, right? And so now in the workforce, when you tell people, especially since I'm working at UCLA, and it's just, you say I graduated from here, and it's, oh, you graduated from here? And it's always that second guess, or like that second question. You're like, yeah, and you're super proud of it. And versus like my other coworkers who graduated from, all these other schools, oh, I just went to whatever. And I'm like, okay, I'm like,
Right.
almost, I'm like,
Right.
I almost don't even want to say that I graduated from here. I just want to keep it humble.
Yeah, I know.
But, and then the professionalism aspect is, all of my professors here were professional, whether it was guest speakers, just my professors, anyone that I came in contact with who was our higher ups, everyone was professional. Everyone said words that I didn't even know what they meant. And it's just this whole, even the building, right? Like you enter and it has this aura, and I just feel super grateful to be a Bruin nurse.
Thank you, Debbie. Ursilia.
Can I
Yeah,
can I just jump in with one word? Excellence. That's the thing that I keep hearing. We have a legacy of excellence that we got from UCLA, however we applied that. So that's what I'm hearing from everybody today, the excellence.
Yeah, UCLA has opened so many doors for me. I mean, just the name alone, it is a brand. You know, that in Disneyland, that's what everybody always wants to talk about. UCLA and Disneyland. Tell me about those two things. The interesting thing is I was dyslexic when I was in second grade, and my neighbor was tutoring me, and she was a UCLA cheerleader. So she became a teacher, and I knew I was always going to go to UCLA, even as a kid, somehow, some way, you know. And it's like I got an email one day and went to the information session for the master's program. My friend from elementary school was actually giving a talk, and she stops in the middle of her talk, and she's like, "Arstelia," like that, and it was like. Like what? It was like it was in a movie. And I had just gone to Italy, and I had this Gucci purse. And she's all like, after she came out, she's like, the reason why I was just looking at your Gucci purse and I saw your face. And I knew, and that Gucci purse, go figure, also got me into UCLA.
The Gucci purse.
Because Jan at the time was like, you come here, and she like interviewed me by myself. She's like, you're in because I like your Gucci purse and I want to go to Italy. So you never know, but I think I was always destined to come here. And I loved it, loved the school, you know, and like I said, it opened up so many avenues for me by just going to UCLA. And then working with other UCLA nurse practitioners has been amazing. Like, children's was great. You know, you have so many colleagues. I still talk to so many of them. And you're right. Like other people, you're like, where'd you go to school? And they're like,
Yeah.
you know, I had a nurse practitioner one day a few years ago, and I was like, hey, where'd you go to school? You look so familiar. Did you go to UCLA? She's like, no. And she did not want to tell me where she went to school. It was like she was annoyed at me. I was like, come on, where'd you go to school? You know?
Yeah.
And even with teaching, like my students were always in awe, wow, you went to UCLA. And stuff. So it's been amazing.
Great, wonderful. Well, thank you everybody for your time this afternoon. I do want to thank our 7 alumni who made time out of their day to join us today. We will be posting this video on the School of Nursing's YouTube channel for those who want to go back and rewatch it. Thank you everybody, and have a great rest of your day.
Thank you, Lauren.
Thank you.